Season 3, Episode 11, A Case of the Missing Brussels Sprouts. And a warning, this episode discusses a fatality. The team lament about the phenomenon of media reporting in an article about the strain of grocery delivery delays, yet the reason was because of a fatality in a national grocer's distribution and warehouse centre. It's not about the Brussels sprouts, says Alan. What about the fatality? He asks. Trajce is infuriated. I've read far too many victim impact statements to take any of this lightly. Sara presents the idea of a high reliability organisation which is characterised by preoccupation with failure, a reluctance to simplify, sensitivity to operations, commitment to resilience and deference to the right expertise at the right time that is needed. She contends that organisations often rationalise their comfort with average performance by linking their readiness to a mid-par rank on an arbitrary maturity scale. Sara advocates for think great, act great now by recognising that there are emergent properties of adaptive systems and organisations can leapfrog past complacency and jump into great projects or far more improved systems with the right framework and orientation to success through human factors approaches.
Yeah, willing and able. DJ Code Red, Saber. We're gonna get this started. Yeah. This is how we starting it. Let's get started, 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 let's get started. Who's gonna start this? We're gonna start this.
Hello and welcome to the Why Work podcast series. You are listening to Trace Vitkovsky, Sara Pizzell and Alan Girl. And you texted me.
Really?
Yes. And you presented, it was a link to a really interesting article.
Oh,
what's that about?
Oops.
We can edit that. We can edit that, don't worry. So tell me about that story.
There was concern, a grocer, national grocer chain. There was concern that groceries weren't being delivered. And that's the first thing I really saw in this headline is, hey, we're short on our groceries. Our lettuce hasn't been delivered on my shelves, right?
Well, short of fresh food.
Short of fresh food?
Short of fresh food.
Oh.
And supplies, right? Third world, what are we doing? But the reason was because there was a fatality. So this was affecting the supply chain.
Right. So can you read a bit out of the story?
So hold on. Let me. I know I say this all the time, but we're just working off media reports.
Yes.
Yes.
And I've
It's
done
important.
some work for that particular grocer, and they are very concerned about safety. So I do feel as though this media report is presenting one
view. Tragic death of a distribution center worker earlier this week resulted in significant supply shortages throughout some states' stores. I'll just leave it
I think the terrible thing about it is the way the media has portrayed the story.
Yeah, I'm not interested in the safety aspect, but there are quotes in that story
about some of the shortages.
Yeah. And the quotes, it was more the words used.
There's been an impact on supply for some products, including fruit and veggies, due to a tragic accident that took place at a distribution center. Our work teams are working to return stock to normal levels over the weekend. Now, that gets a rise out of Trajce because I think, Trajce, help me out. You're less concerned about getting the stock back and more concerned about the fatality. Is that what I understand?
Yeah, it triggered for me a little bit because somehow that story...
But here, we thank our customers. Thank you for our understanding. But underpinning this is there's a death and a couple other people, workers, who are seriously injured. But stable.
Yeah, I think it could have been reframed.
But why are we even talking about that? What's it matter whether you can get Brussels sprouts or not?
Yeah, exactly. And that's the point I'm making.
That's what got a rise out of Trajce.
That's what got a rise out of me. And unfortunately, I probably wouldn't be as heightened, but for a number of years ago, there was an airline and the issue arose around queues.
Lines for my American and Canadian
lines, queues.
Canadians might get it.
What happened in that particular case? So not all the counters were open, so the queues were longer. So obviously, if you roster more people, you know how the story goes. So the rosters were obviously shorter. Counters were therefore, I think from memory, you could have up to 15 at a busy period. So 15 operators. Desk clerks. Now we have the machines and we've got rovers and we've got, you can do your auto check-in, you can do it online, etc. But this wasn't that long ago. It was around 2000 and it was this century. What struck me with that story, on this particular day, a customer, a patron, a person intending to fly, had an event in the queue, natural causes, and died. And so, of course, it was panic, fallen, and nobody knew at the time. But it was the fact that people were walking around or stepping over and still asking, will this delay my flight and so on.
Am I going to get to plan A and plan B?
And that really caused the workers so much distress because of this. So anyway, my point of that was that to me, it just struck me that sometimes humans, that kindness can and sometimes be...
You lose benevolence, you lose kindness when you're
so all for the pathological...
stressed,
all
in a hurry.
Because business imperative...
All about me.
Yeah, and all I could think of was, because one particular person said, I hope my flight's not late or delayed. And all I could think of was this person was more...
How did you actually know that
because it was in the statement. It was made by the... So it was an investigation as a result of this, and, there were drafting of improvement notices and so on and so forth. But the fact was, for me, I was so disturbed by the fact that clearly this person, perhaps it is a good person, but the fact that the immediate thought was, I need to get to this meeting, presumably a business meeting and a conference. And that's just how this article, it just triggered that for me.
Doesn't that happen a lot even on road delays? I'm kind of like, well, hang on, somebody's probably had a collision. They may be having a far worse day than I am. And I consciously remind myself that there could be something really significant. And often you drive past a collision and I just go, peace be with everybody. I wish them grace because they probably had a worse day. I'm laughing a little bit.
It relates to work. That's why I'm mentioning it.
Yeah.
So you might be late for work with a delay. Clearly that fellow was late for his flight to wherever.
You guys know if I've taught fitness classes for years and years. It's just, part of my makeup and I love it. And it's my extra fun unwork away from work. And one time I was teaching a step aerobics class and right at the end of the class, I was like, come on, guys, girls, let's go. We were doing some plyometric jumping jacks at the time. It was years ago, just for the record. And I do my ACL. My left knee just goes, right? But there was no pain. It just collapsed. And so my anterior cruciate ligament gave way, right? I go to pick up my things. I'm thinking, wow, it's hard to stand up right now. I wonder why I'm just blowing up and I'm getting swelling on the knee, right? And I'm thinking, I wonder why this isn't working quite right. And I think I better go check this out, right? So I'm kind of hobbling, and I normally would have taught a cycle class right afterward. As I'm having difficulty going from ground to stand and collecting my things to go talk to the front desk about some alternative strategy, I'm thinking, do I teach off the bike? What do I do? Ladies are walking in. One looks at me, watches me hobble, and says, gosh, I hope cycle's not cancelled.
And
the love, right?
So just see, but that's why the story gave you that right. Thanks, Sarah.
It comes into context, and you're just like, no, it's all right. I can teach off the bike. Don't worry, right?
Yeah. So, and
I've got to
Did you go on to teach the cycle class after?
No.
I taught part, then the reception lady came, and we juggled a few things, but I got it going. I got it started. And I have to say, I work with some. I teach some fitness classes, and I have so much support from so many members. So I've just got to preface this to say some great, lovely, lovely folks who go out of the way. But this was years ago at another venue where I wasn't that regular there yet. And, it was just like, annoyed about me,
just
right?
saying your Brussels sprouts will arrive. You won't go hungry. We've got your food will arrive. So we don't need to sort of, particularize. Look, things are a little bit delayed because there has been an accident.
And let's talk about what the accident was. The supply chain team member has died. Pallets collapsed at a factory. So we've got that'll be unpacked literally, figuratively. You'll probably tell us more once you see the case.
Yeah, but unfold. It was just I just didn't appreciate that story the way it was spun, because if you read between the lines,
What's in it for me?
If you read between the lines, like, hey, it's going to be business as usual. You'll get your tucker. Things will be great. It'll be fine.
That's food for my friends in the US.
And the first thing that came to me was stop. A person has died. Don't care about your metrics. Don't care about your OHSE performance. Stop. A human being has died. And that's why, I can get a little bit sort of worked up in that
You've
sort
seen
of prosecutorial lens. Because
difficult cases.
I'm the one who's
it's unusual for us to see you worked up.
Yeah. I'm the one tendering those
This is the dear who can, reconciles relationships with everybody.
What I'd like to say is, here you go. Read this victim impact statement, CEO, and don't forget Section 27 due diligence, brother. Read this. Read the victim impact statement.
That's the prosecutor you coming out.
And then repeat it 1,000
Ouch.
times, and there might be a little bit more benevolence. That's what I'm saying. I shouldn't have been so impassioned about it, but here we are.
Oh, why not? That's in your
what it
makeup.
is. It's
You've
like
seen
that
too many of
story
these
didn't have
impact
to go.
statements.
You know, the things, you know, it's always got to be, how do we spin this? How do we turn this into something that's reasonably justifiable? No, it's not. Someone's died. Stop.
So you're talking about the media this time.
Yeah, it was just the way.
Talking about
The media doesn't have a story unless it's been given some press release and some facts. You can't just simply. Otherwise, there's no truth in reporting. Then there's complaints. But they were quotes.
The media puts the spin on the article.
Yeah, the media puts a spin. Except the words came from. They were quotes.
So it may have come from someone or you know, who knows.
They would have interviewed, but they were inverted commas.
It's
if you
the
look at the
whole
report.
the system of care. I think you're getting at.
Yeah.
So we're not doing a shift blame here there. You're saying
it's
no
not a
matter
shift
what,
blame.
the focus, our tolerance, our cultural tolerance should have been the focus on the fatality.
And that's what I'm getting at.
Look,
Come on, you're in between. You know what I'm saying, don't you? Someone died. You're not getting your Brussels sprouts. Someone could have simply said you're not getting your Brussels sprouts because of a serious disruption due to. I'm not a marketing person. I don't get paid enough to do that. But the point is, you know what I'm talking about. I just didn't like it. From a human perspective, not a professional. Just didn't like it.
From a human perspective.
You know what I mean? We're humans first, pros second. You know what I'm saying?
Who's gonna start this? We're gonna start.
So what do you guys think when you think about this language, this discussion about high reliability organizations? So whether you're a recreation provider or whether you're in safety systems or whether you're looking at safety critical work like tire handling, what's from your legal hat, Trajce, because you often talk about doesn't matter, pointing into the law, case law, when something hits the fan, we investigate. But if an organization is working incredibly hard to fit the bill of being high reliability, it means they're very sensitive to variances, that they sponsor projects, they continually look at safety critical events, they're preoccupied with it, in fact, right? So they really spend a lot of time investigating all the things that might go wrong and the safe to fail alternative plans. They've got good community goodwill, perhaps. They're doing some great things for the community. Does that help with your defense?
It does, definitely helps.
So what do you say to that,
Is
Alan?
there reluctance to simplify, and they'll go ahead and defer to expertise. So we talk a lot about consulting with workers, but there's a little bit of a pause when you talk about co-design, because you actually need to defer to some level of expertise. You need some scientific evidence. We've talked about this. And you actually need some design strategists and people who are uniquely qualified in their respective design practice. And each design practice has subcategories of specialization, just like law does, right? So a high reliability organization, HRO, that fits the bill. And I don't like to, it's really hard because an organization is live. You know, when you try and do these cultural maps of readiness levels for change, and you do these sort of capability scales, it's not binary. It's not just left end or right end and on or off, and gradations of readiness for change. A high reliability organization is dynamic and live, like a spider web. I always think you can leapfrog and become high reliability quickly if you commit and have the right people involved. Yes. You don't have to just wait through, we're this level of capability, then we need to progress to that and stay stuck in not doing much very well.
It's that dynamic.
Dynamic, and go for greatness now. Don't wait. Don't think maybe tomorrow. Go great now.
Alan, you work closely with industry.
It's about resilience and sustainability.
So Sara, I think Sara has said, do you see those things happening? This real-time, active, like, don't wait for something to happen, do it now, like
And don't just think once we have this, we can be a better organization, you know?
I think...
we're not ready to think in this level.
When you look at industry, you've got the full spectrum of different types of organisations, but a lot of the organisations I deal with, the CEO and the directors and the general managers, they're all trying very hard to have a safe environment where workers are looked after, and often it comes as a shock when something goes wrong.
Yeah.
This idea of let's go for greatness now, I think a lot of them would welcome that idea.
Yep.
Yeah.
And
But
does
are
it help
they?
your
Are they
defense
doing
if they have this community goodwill and that they're really spending? So you got prosecutor over here saying, "Hang on, pointy end. I'm outraged. I've seen the victim impact statement," and you have an organization on this hand who's trying incredibly hard to design right.
So
And they've got operations to
a lot
take
of the
care
cases that are fiercely contested is where you have an organisation that's trying very hard to have a safe working environment, and the holes in the cheese have just lined up, and something's gone terribly wrong.
But you said trying very hard. That very comforting to hear. If you can show that, and hence you said genuinely shocked when this happens, because nobody wants their legacy to be, on my watch these awful incidents occurred. So no, I do get that.
It's quite common, particularly with the bigger organisations. If there's been a fatality, for the CEO to hop on a plane, might be on the other side of the globe, and to fly back to talk to the workers that were closest and to talk to the family members.
Yeah.
Now that's, when you look at a big international company, it would have very busy calendars, and they're just dropping everything to go and attend on those people. So there's people with very strong principles, good principles, who, when I say they're shocked, they're genuinely shocked and genuinely upset.
Well, let's talk about another industry. If I take you on a tangent, talking about healthcare, because I mentioned earlier work design being about service design, and a lot of attention often is on external customers. So clients, healthcare consumers, there's a lot of attention on healthcare consumers having the right experience, or in a lot of regulations around this, et cetera. But oftentimes there's not the same level of appreciation for understanding the healthcare worker experience.
So we can
internal
make it,
customer.
Yeah, we can make it even more basic than that. Let's talk about nurses.
Let's talk about nurses.
So there's been a
the
lot of
lifeblood.
Yeah.
Well, there's been lots of cases
Trajce's
all
wife
around
is a nurse.
Australia.
No, she was.
She was.
No, just getting back to
This
your...
is the second wife.
No, I don't have a second one, just for the
Don't
record.
listen.
And yes,
Okay, so if you think about Sorry,
okay, we can use some of these off cuts.
I lost it now.
No, it's okay. Agatha Christie. No.
If you think about the nature of a nurse's job,
Yes.
it's different to other types of jobs. They're dealing with people who are injured in some fashion or another, and who may not recover. They may pass away. Now, that's unlike any other job. So they're quite unique. The medical profession is quite unique.
Yeah.
And what we're seeing around Australia is cases where people have not survived their medical treatment, or something's gone wrong in the medical treatment. And we're also seeing cases where patients are assaulting nurses, or there's a concern about patients assaulting nurses. And that's unusual. You do get that in other areas, but it's unusual where the customer assaults the service provider.
Phone companies have signs all the time saying, please, we expect,
but it's
different level.
The concentration is much higher in the medical profession.
I've just read a paper from Dr. Jan Golombewski, excellent paper, talking about how the built environment, the design of the built environment can trigger the psychoses.
That's exactly
really
right, yeah.
interesting, because so much we just think of it as an individual problem, right, as opposed to thinking about all these design factors.
Knowledge of the role, the critical role, nursing plays. So,
and also a very deep desire to make people well. The problem is that very strong cultural driver, the caring role of a nurse gets in the way of their safety.
Yeah, because they might
they might take risks
look after
that they shouldn't take.
others rather than
and this
themselves.
is nursing it deserves the spotlight.
I work with healthcare organizations, and in fact, we've just submitted the manuscript for another book in the Workplace Insights series, and it's called Healthcare Insights. And what's interesting about this, among many of the healthcare stories, is we took a perspective from the consumer. So we have some consumer stories. We took a perspective from the healthcare practitioner, so there wasn't blame-oriented, but they could explain the realities of their work. And then the work design strategist, what would you actually do practically to solve these real-world problems? So it's got three perspectives, three sections in the book.
So some of that solving the problems can be really complex. I mean, you were talking about work design. if you have a patient who's got some sort of a psychiatric problem,
Yes.
the built environment may have an impact upon how they're responding and how they're behaving.
Workflow, job design.
We've had cases on that. I think, Trajce, might have even been one running through before you finished as a prosecutor. There was certainly only one that I've assisted with before. But should nurses have a workstation where they can go, where there'll be a physical barrier between them and the patients?
Yes.
Which is important in wards where you have patients with psychiatric problems of some fashion or another.
Yeah. Nursing is such a frontline job. Now add to the mix, there is a great deal of empathy, compassion. The care factor is very, very high. That in itself heightens, doesn't it, the inherent risk, because these workers genuinely want to add value to by helping that person, get better. So where do you see the dangers? What's wrong with dangers?
Oh, there's lots of
gosh.
dangers. And from a legal perspective, lots of dangers. So
let's start with the physical, then we'll do psychosocial.
So we've got let's just acknowledge the psychosocial, and that's because that's a big area
It's performance
for nursing.
that's embedded in both physical and psychosocial. It's performance.
let's run a list of
Physical
what are we
is
talking
being
about?
physically assaulted.
Yep.
And that happens in quite a few areas of nursing. You've got system controls to medication. You're dealing with medications. You've got to make sure that that's all managed properly, all documented,
Errors
all
that can
recorded.
happen, and the psychosocial stresses of making an error is terrible.
It is so easy
Interruptions.
if you're not recording the use of medications to overdose patients.
Oh, the trauma
So you
of
have to absolutely record that.
Yep.
And if you have an area where you store leftover medicines, it's really important that that's managed properly too, so that you don't get overdoses. And
physical, the lifting.
the
Physical
the
work,
lifting.
musculoskeletal.
Helping clients transfer, no matter what they say, it's like a no lift policy, but you're subject to somebody who
Violence. So we've got those.
falls.
And one of the real
Maneuvering
problems there,
humans is-
so if you're dealing with elderly patients who have dementia, they might slap you,
and the performance can vary. So
But even abuse you verbally, and
which is again you get to the psychosocial.
and a care plan sounds static, but performance can vary among clients. What consumers, what medications have they just had? What mood state are they in? What's their nutrition been like? So their performance can vary of how much they can actually assist you during their own transfers.
There's also at an organisational level, and I've had the advantage of reading a few files where things have gone terribly wrong. There's a lot of pressure from management, and management might be highly skilled medical professionals who've gone on to take administrative roles, and they want things that place nurses at risk.
And regulatory
hang on.
requirements are incredibly challenging, though, too. So think about the Royal Commission. And I've had nurse managers say, oh my gosh, we can't do our job because we're too busy always responding to yet another audit.
Oh, yes,
So they're
there's
having
a
a
lot of
hard
audits.
time.
Yes.
So I've managed healthcare organizations, and I was a young executive in community healthcare, and I had spot audits from Medicare. This was in the United States. I'd have Office of the Inspector General, so divisions of FBI. I'd have company audits. I had accreditation audits to get through. In the meantime, you actually still got to provide the core service.
Have you watched
and
Nurse
helped us
Jackie?
get through that. 5 audits one year, I remember. That's a lot.
Nurse Jackie, have you watched that?
Nurse checking?
Nurse Jackie,
No.
6 seasons, I think.
Well, there's another risk.
It's worth a watch. It's worth a
No,
watch.
no,
For
add it
me,
to
it's a
my-
person who just wants to help. But
Look, and
But
what
one of
happens
the
once
one of the other risks that you get in with nurses is then when something goes wrong, where a patient dies or is seriously injured, the legal profession wants to focus in on the simplistic
individual
answer.
behavior.
So we look
Yes.
at that. We look at that.
It
So
happens
if
again and
someone
again.
falls off a toilet and they break bones, and as a result of the broken bones, they pass away.
Yes.
the focus will be on the nurse who was supposed to be watching them while they were sitting on the toilet.
Not the distractions that they had, the system of work, the overtime they were doing,
toilet.
the design of the toilet, the access of the toilet.
I did a sling one in the guilty plea
Yeah.
hospital. My first ruling out was this is all the equipment the nurses had. It was a mismatch harnessing sling to transfer a 91-year-old patient.
In a hoist?
In a hoist. Now, there's nothing wrong with mismatching, and the first thing I did was get my forensic engineer's report to look at the equipment, and he said, this is brand A with brand B, but that's okay. You can use brand A, you can use brand B, but on this occasion it was brand A and brand C. So the methodology was fine, mixed methodology, not a problem, but unfortunately, equipment that these workers were given was mismatched, like inappropriately mismatched equipment. They've connected the hoist with the sling, so they've clipped it. They've transferred the patient as per protocol. Unfortunately, the patient's fallen out, ribs crushed, and a few hours later died. I think about just how shattered those workers, those two nurses were, because this is the equipment, the training, the apparatus given, and it wasn't their fault. Yet they had to bear the burden.
And I'm going to go even bigger than the micro of that point in time transfer. Let's go macro. Was the organization one that adopted a positive aging approach? Why were hoists relied upon if whether or not good nutrition could be better managed, if the idea of really assisting people to perform at their best is giving them movement opportunities, redesigning their days so that they actually could, combat ageism, which often propels, workers to think that these people are not capable
one
of
of the issues, and it's not just nurses, it's other professions as well, is that where humans are becoming bigger and heavier, and it's difficult for nurses to move some patients.
Absolutely. Care sometimes is not focused, sure, but in practice might be different.
Actually, at first I thought, where the hell are you going with this, Sarah? But now I get it. It's a good point, because this person it wasn't an issue of size. For very small, when I say small, a very light 91-year-old person. So, yeah, now that I think about it, I think you needed a hoist.
Is it re-enabling people or disablement framework?
No, I like
because it completely changes the way you prescribe what needs to be done for someone. It just would have been,
getting back to your static point before, it's always done with the sling, hoist, just use it. Whereas a dynamic approach...
I've had that where care plans say, the person can only transfer with a physio. We need to use a hoist. And I've gone with somebody I was caring for and said, this person wants to go and try and go to the toilet. Sorry, we must use a hoist. But he doesn't need the hoist. He's showing already he doesn't need the hoist. And we're only going to help him go to the bathroom once the hoist is available. Well, in the meantime, they've soiled themselves and their skin integrity issues. Hang on a minute. Hang on. Is it disablement or ablement framework? Right? What are we talking about? And then they become more dependent again and again.
Dignity issues too. I think, particularly for older people, they should have a level of dignity and they should not be left sitting in
soiled pets. So now we're talking about governance, over-regulation, fear-based action versus feeling like you have a safe-to-fail place. Like, what happens if somebody does have a fall? If we're going to be blamed, I'm only going to use the hoist. Yeah. So what's the culture? I'm going back to Trajce. She loves that social system.
And then we get back to the problem with the legal system. It's going to focus in on whether or not the nurse has done their job, rather than asking what were the staffing numbers.
Of care.
Yeah, what's the system?
And on that note of staffing numbers, so because I do consulting work and research work, and we look at healthcare all the time, I start to prepare organizations, especially in healthcare, but across so many industries, to say, don't think for the next 3 years, think for the next 10, 20 years. You have a skills shortage and a staffing shortage. Plan in advance. If you think you need to train 10, start training 20 people. If you think that you need to prepare for a little bit of technology support, think 3 times that much technology support.
I think that's a really good point, because the complexity of what nurses do it's very complex stuff. The doctor might come in once every second day and is only there for 5 minutes. For the rest of the time, it's the nurses that are managing that human condition, whatever is the
variable human condition, right?
And it's a sustained role. They're having to anticipate things that could be occurring, and invariably having to make the decisions. You're right. It is the pointy end where they're because they are there.
And they have to make, if you just look at wound management,
Yes.
that's a really complex thing, and it's an ongoing thing.
Yes.
And you need to have skilled staff doing that.
Yeah, so, you're right. So I think that the nurses really bear the brunt, really, of the system. I mean, they're the warriors.
And when you look at Sunshine Coast, where there's a huge demand for nurses, which I'm sure is true for many other places, but
aging population,
there just isn't the numbers there.
They're not the numbers.
Yeah, you think the Sunshine Coast is one of the fastest growing, like Budrum and other places. There's such a huge ageing populations, a huge retirement.
I'm there.
Like,
It's all happening there.
God.
So
Sitting here next to the beautiful Sara.
Oh,
She
Sarah.
looks all of 30.
Sarah,
She's
Sarah,
old. Come
Sarah.
on.
No, I'm just saying. Come on, let's go. Let's go.
All right, press play and plug in the microphone cable. Next up is the crew willing and able, satisfying your thirst. Come and clean on the verse, precise and rehearsed.
We hope you enjoyed that episode of Why Work. You've been listening to Trajce, Sara and Alan, and if you'd like to know more about some of the things we've talked about today, please subscribe, and we'd be more than happy to provide you with information and other things that may interest you. Please be aware that none of the matters we've talked about today should be construed as legal advice or any other type of advice. We're just here to talk about all things related to work. See you next time.